Just over 1 in 10 American adults have what's called high cholesterol, which can often be lowered by changing one's diet, exercising more, or medications.
But even more people, around 1 in 6, have high levels of a type of cholesterol that can't be lowered with standard treatment. Dr. Frank McGeorge is here to explain why knowing that level can be important.
Yeah, Ty and Kimberly, it's known as lipoprotein A, or LPA, and it's a type of cholesterol whose level does increase the risk of cardiovascular disease, but because its level is mainly determined by a person's genetics, the approach to managing an elevated lipoprotein A is different.
Lipoprotein A is not something that's tested as part of the routine cholesterol panel that most patients get at their yearly physical exams. It's something that your doctor has to specifically order. I recommend that because it doesn't change much over the adult lifespan, that most people get it tested once in their adult lifespan, and then they know for the rest of their life what their level is.
But Dr. Eric Brandt, Director of Preventive Cardiology at University of Michigan Health, says lipoprotein A levels are difficult to lower. But if you do have a high level, that's all the more reason to control what you can.
Just because you have lipoprotein A doesn't mean that you're doomed to have cardiovascular disease. There are a lot of other variables that impact your risk, and there's a lot of ones that we can control or that you can control by making modifications to your lifestyle, like eating a healthier diet or exercising more. So I don't like people to walk away with this fear that they're going to absolutely have heart disease when there are things that we can do to prevent it despite the high levels.
There are drugs in development to target lipoprotein A. In fact, one candidate decreased levels up to 94% for participants in a clinical trial.
Hopefully in the near future, we'll have a new way to lower harmful types of cholesterol and hopefully prevent cardiovascular events.
Now, because of the strong genetic influence, there are racial differences in lipoprotein A concentrations. Specifically, black individuals are more likely to have 2 to 3 times higher lipoprotein A levels than white, Hispanic, or Asian people.
And doctor, I guess the question for me is, if it's so common, why don't doctors routinely test for it?
Right.
Yeah, so, there's actually a couple of reasons, but the biggest is that there hasn't really been much that we could do about it. In other words, knowing the level when we can't change it isn't super helpful. But as we learn more about how it contributes to heart disease and develop specific treatments, testing is probably going to become more common, and it will probably be something you will hear more about in the future.
Good. Okay, Dr. McGeorge, thank you.
Thank you.